Can you tell us about the two types of brain tumour and what's the difference between them?
Yes. It's very common, unfortunately, to hear families, particularly during their relatives' illnesses or after losing a relative, to say, oh, my husband, my wife, my daughter had a brain tumor. Now, this means many different things. We have actually many types of brain tumor. First of all, I wish to simply define two groups, benign and malignant. Benign means there is an overgrowth of cells and of the blood vessels in the skull, in the actual covering of the brain, somewhere around the brain, but it does not invade. And that's terribly important, this idea of invasion. Invasion is the thing which is extremely dangerous. Now, these benign primary tumors of the brain, they may or may not be operable, but they are hopefully operable. A large proportion are operable. They may affect the patient's personality, but in the main, it's pretty good news. So if one has a brain tumor and the doctor comes in and says, oh, it's a brain tumor, but it's benign, there's real room for celebration, not absolute celebration to go out and dance in the streets, but it is usually treatable, copable, and in most cases does not shorten the patient's life. So we always love to give that news. Look, it is a brain tumor, but it's benign. But we're still talking about tumors starting in the brain. Then you have, unfortunately, those brain tumors which have the characteristics of malignancy everywhere, but I wish to slightly qualify that, because brain tumors are the only tumors that do not usually spread to other parts of the body. Now, when I use usually, it's nearly never. There's probably the literature will tell us 1% of these tumors could spread, but they actually don't. They're confined to the brain, but they invade in such a way like a crab. They interfere with the functions of the brain, and eventually they cause great pressure in the skull, in the brain, but the bones covering the brain, and these are the malignant tumors. Now, I don't know how much detail to explain and how valuable it is to you all, but these tumors are then divided into more malignant to less malignant. Now, the very malignant tumors, unfortunately, that means, when I say very malignant, it means to us that the cells are rapidly dividing, and they're not giving a chance for the person to recover and to get rid of these cells. To other tumors that still invade, but at a slower rate, they usually have some sort of barrier between them and the rest of the brain, but they are still malignant brain tumors. So that's our first group, divided into two groups. And I'm sorry to make this complicated, but that's how it is. And I think people must be aware that it's not a blanket group of tumors, even those starting in the brain and in the skull. And then you have the more common tumors, and that is tumours that have spread from other sites. Now, this is extremely common. Most of the patients who will come with a fit or will come with headaches will have a cancer somewhere else. Now, in the majority of these patients, their cancer has already been diagnosed, so it's part of their disease.
So it's already malignant.
So it's already they have been diagnosed as having lung cancer, particularly, or breast cancer or colon cancer. So when they get these symptoms, the doctor will relate it straight away. But there's a large proportion of people who just present with these secondary tumours, and because it's secondary, it didn't start in the brain, it started in the bowel or it started in the lung. And these are the most common of the brain tumours. Now, fortunately, we have made big strides in prolonging the life of these patients. We have various tools at our disposal where we can treat up to, in some cases, 10 or 15 of these little tumours throughout the brain in one go, and the patient may live several years. So I don't want to paint an over-optimistic picture of it all, but I also want people to understand that brain tumour doesn't always equal death. Brain tumour doesn't always mean it started in the brain. Brain tumour doesn't always mean that there's nothing we can do. And in fact, there's really good news for people now, that one of the commonest secondary brain tumours starts in the skin, a tumour called malignant melanoma, which is very common in Australia because they're sun worshippers. I don't know where Bondi Beach is. I know it's only glamorous for glamorous people. But I know there was a very high incidence in Australia and people died. Now, we have really good methods of treating those brain when they spread from the skin to the brain in the form of immunotherapy. So we are really progressing. As we define more and more the type of tumour, as we get more interested in both the macroscopic, how it is seen on an X-ray or by the naked eye, to the genetic makeup, we are getting better. This is what is giving us all optimism that we will progress in this field. Thank you for listening. I hope you found this interesting, and if you did, please subscribe.